Hello, Fort Riley. My name is Lieutenant Alexandra Skazafava. I'm the Chief of Physical Therapy at Irwin Army Community Hospital. Who I have with me today is Specialist Mendoza. She is at 37 weeks of pregnancy. And what we're going to do today is take some time to talk about and address back pain, which frequently occurs with pregnancy, in addition to good tips and tricks for exercise during your pregnancy so that we can have good outcomes after delivery and have a great return to full duty. So one of the big changes that occurs in a woman's body during pregnancy is that our body starts to excrete a hormone called Relaxin. This hormone is really important because it allows for our pelvis and the ligaments in our pelvis specifically to widen, to allow that baby's head to fit through the birth canal during delivery. So we have a nice little prop for you here. This is exactly what our ligaments look like when we're not pregnant. When we progress to the later stages of our pregnancy, our ligaments start to get really stretchy, and then also that baby starts putting weight down on those ligaments, which can cause a lot of pain, especially in the low back, the hips, and the pelvic area. In a woman who's not pregnant, our base of support is somewhere around our midsection in the middle of our body. But as you can see, as the baby grows, your base of support travels further forward. So I'm gonna have you turn and face that way for me. So you can see on Specialist Mendoza here, she does a really great job compensating for it, but she has a little bit of a more of an arch in her pelvis because that baby is pulling her so far forward. As you can imagine, this puts a big strain through your back and can be one of those reasons why we have an increase in pain with pregnancy. Another way to help decrease low back pain when you're standing throughout the day is to really think about your posture. So you can see right here, Specialist Mendoza kind of has her knees locked out, and then she has more of that arch, that sway in her low back. One way to fix this is she's gonna bring her pelvis underneath her. So go ahead and do that for me. Bring that underneath you, good. So what that does is that increases some of that arch back there. And I'm not saying that you hold this position all day long, but it's a really great way to just decrease stress for the short term. You can go ahead and relax for me. Another common complaint that I hear is that when women are working, folding laundry or doing dishes and they're in a forward position, because they have so much weight down here, that puts a lot of strain through their back. So we've had really great success in decreasing your back pain. If you just pop one leg up on a step or a stool, and then switch that back and forth every couple of minutes, that can decrease a lot of stress that you feel back through there. Some women will even open the doors underneath the sink and then just pop one foot up on that ledge. For low back pain when sitting, what you can do is take a towel and roll it up nice and tight. The best way to do this is to find a chair with a pretty good support, so a high back, just like this one. Then you can take that towel and lean forward for me just a little bit. Her hips are all the way back in the chair, and I'm gonna take that towel roll and I'm gonna shove it nice and low. And that's gonna support the normal arch and the normal curves of our back. Good, how's that feel? Feels pretty good. So another way that women will get some relief with sitting is the way that Specialist Mendoza uses throughout the day. So if you wouldn't mind showing us that.
You keep your feet wide, keep your back up, and it's not a hard surface like this, so it makes your pelvic floor feel more
supported. Yeah. And the other thing that she can do with this is that she can bounce up and down, and that movement helps those muscles to relax and tends to release some of that pain and that tightness that she feels in her back throughout the day.